does HIV always lead to AIDS?
Well, yes, HIV will, HIV will lead to AIDS, but you're not going to get infected by definition. In other words, it's not going to mean that you develop enough viral load that you could be diagnosed with AIDS disease, but that doesn't mean necessarily, and I could be talking here something I'm not 100% sure, an infectious disease person will be most likely to identify this correctly. But the thing with the original AIDS, how we describe AIDS, was an immune disease that affected multiple organs. Now, you could have the virus and carry the virus and be HIV positive and not necessarily develop AIDS. Okay, so yes, in order to really clarify that, yes, you could have HIV positive and not necessarily develop the AIDS disease.
So once you have it, there's no cure. So is it manageable then to be able to ensure that HIV does not turn into AIDS? Is that possible or simply beyond normal health?
No. There is. That's what all those medications that we have nowadays is really to prevent HIV to develop into AIDS disease. Now, not only there's medications now that once you have HIV, you could be treated by it, and that way you prevent from your viral load to increase. But there's also in high-risk populations, there's medications for you to prevent getting HIV. In other words, there's medications that you could use pre getting the disease to prevent from you getting the disease, and also there is medication that you could use post-exposure. In other words, that particular patient, she could have been treated in a post-exposure medication, and maybe she would not have developed the disease if she would have found out early enough. In other words, once you, that's why it's so important to be tested early and to find out. If, for instance, you're in a relationship and somehow your partner has found out that he has HIV, then it's very important to you immediately to go to a doctor, be tested, and you could be started on post-exposure medication and medication that prevent from you developing the disease.